Bernard is on it.
Okay.
On doing the transmission. So, oh yeah, in the end, just when we say we're done, there's a lag to YouTube, like a 30-second lag. So if when we are done, we can
Hello, bom dia, good morning or good afternoon. I am Jennifer Safi, the UFSPA Vice President and also the Internationalization Office Coordinator. I would like to welcome you all to our second conference of the fourth Internationalization Symposium, which will continue until tomorrow. Please take a look in our full program. In our symposium, we will take the opportunity to discuss the role of the international cooperation, the internationalization of higher education, in the construction and the execution of policies and actions that aim to ensuring a healthy life and promoting the well-being of the world population. I just would like to give you a friendly reminder for those that are registered for the Congress, for the UFSPA Congress. Please, you should watch this session log in the Congress website in order to get your certification. Please don't forget that. And today I'm very, very happy to welcome Dr. Keith Martin, the Executive Director of the Consortium of Universities for Global Health, the CUGH, who will discuss with us a very important subject, which is the academia's role in impacting global health challenges. So I would like now to open the floor or the screen to our mediators, Dr. Mara Rúbia André-Alves de Lima, who is in US, by the way, and Dr. Ana Beatriz Gorini da Veiga, and both ladies will introduce our keynote speakers. So thank you very much again, Keith. Very welcome, and I wish you all a very good meeting and lots of discussions this morning.
Good morning, everyone. Thank you very much for the invitation to be part of this table or this discussion session. And it's our pleasure to be the mediators of this conference, Academia's Role in Impacting Global Challenges, which welcomes Dr. Keith Martin as a keynote speaker. Dr. Martin is the founding executive director of the Consortium of Universities for Global Health, as Professor Jennifer already mentioned, CUGH, based in Washington, District of Columbia. Between 1983 and 2011, he served as a member of Parliament in Canada's House of Commons, representing a riding in British Columbia. He held shadow ministerial portfolios in foreign affairs, international development, and health, and served as Canada's Parliamentary Secretary for Defense. He's a member of the Queen's Privy Council. And Professor Mara, please.
Thank you, Professor Ana Gorini. Thank you, Vice President Jennifer. There is still a lot more on Dr. Martin's CV. His primary areas of interest are global health, foreign policy, international development, conservation, and the environment. Dr. Martin has been on numerous diplomatic missions to areas in crisis, practiced as a physician on the Mozambique's border during that country's civil war, and has traveled widely in Africa. He spent many years volunteering on conservation efforts in South Africa. He has authored more than 170 published editorial pieces and has appeared frequently as a commentator on television and radio. It was an honor for me to present your Martin's curriculum, which is an inspiring one. After Dr. Martin's speech, we'll have time for questions and comments by the audience. Those questions and comments can be sent through the chat box of the UFCSPA Congress platform or the YouTube channel. Dr. Martin, the screen is yours.
Thank you very much, Professor Mara Rúbia and Professor Ana Beatriz, and much thanks to Professor Safi for inviting me to the Congress to spend some time with you this morning. And bonjour to everybody. I first want to apologize because I do not speak Portuguese. That's my fault. But I just wanted to thank you very much for the very warm welcome. I have to tell you where I'm sitting right now, and it is the morning here in Washington, D.C., is I'm about 1 kilometer north of the White House. And for those of you who know this city, you know that much has happened with regard to the big social challenge that have roiled this country, and by extension, in many parts of the world, has played out, in fact, right in front of me over the last few years. So I have to say it's been a really interesting time here in the United States as a Canadian to witness what's going on today. And by extension, many of those issues actually have played out around the world, from social disparities to climate change, race-based issues, and much more. And what I thought we would do is take a little voyage together with all of us here about some of these challenges and the role academia can play. And as Professor Mara and Professor Ana mentioned, I'm going to talk for a little bit, we'll have a discussion, and then it'll be open for you to answer questions. But I don't actually give presentations to just tell you what's happening. That's not my place to do that. But I hope together what we will do over the next little time we have together is let's take a voyage and walk through where we are today where we'd like to be tomorrow, and how do we get there? And what is the role? I'd like you to think about what is the role of academia to play in this transition that we must take if we're going to, as Professor Safi said, build a better world for all. So Isabella is going to be kind enough to move my slides, and let's move to the first one. Please, Isabella, the first slide, thank you. Well, the genesis of this talk actually came when Professor Safi and I met at PAHO, the Pan American Health Organization, whose office is here in Washington, D.C. And we sat in an office and put our heads together and we said, let's get to know and see what our organizations are doing and how can we work together more effectively to deal with these challenges. I would say personally, one of the things we're doing at our organization, the Consortium of Universities for Global Health, is we try to connect institutions around the world, recognizing that none of us, and you know this, are going to be able to deal with the challenges we face, many of which go beyond borders. We can't do this alone. We have to do this together. So when Professor Jennifer and I, we sat down, we thought, how can we work together? How can we connect Latin American institutions with the broader global network? And how can we learn from each other and work together? So that's how this started. Pandemic got in the way for us to meet in person, but we're going to do this together virtually. May I have the next slide, please, Isabella? So I think the central question of what Professor Safi asked me to do is what is the role of academia, of all the sectors? How can we take those great assets that academia has to its training capacity, research, and service capabilities, and how can we deal with these challenges more effectively? Next slide, please, Isabella. But first, we have to, I think, take a look at what are we looking at in terms of those challenges. Well, we know we have the old challenges, old diseases that have taken place that are actually changing and moving forward. We've got climate change and the biodiversity crisis that affects everybody. One, thankfully, is more known, climate change. But the other, biodiversity crises, is actually, I would argue, we'll get into this in a bit, the other existential crisis that threatens to undermine development around the world. And you sitting in Brazil are sitting on one of the absolutely fundamental grand biospheres that affects the health of the entire planet. So you're critically important to the solutions to where we as a planet go in the future. We're also looking at changes in politics, instability, state instability, and global instability. We've actually seen the challenges of COVID and what we've done well or not done well. And we've got a population in the world that by 2050 is going to move to 10 billion. We're at 8 billion now. So how do we actually provide for another 2 billion people when all of us hopefully will have a higher standard of living, but we live on a planet that's not able to produce the things that we need right now? In fact, right now, if you look at all the things our planet produces, right, the water, the food, we're actually using far more than it's able to produce. And that gap over time is actually widening. So we've got to think through, how are we going to deal with that widening gap between what our planet produces and what we consume? A gap that is widening. But to understand where we're going, we need some targets, right? Let's take a look. Isabella, next slide, please. We know these are the targets, the 17 Sustainable Development Goals, 169 targets agreed to by over 192 countries back in 2015. Now the deadline is 2030 for us to achieve all of these. How are we doing? Are we able to achieve those? Are we on track to achieve those? Taking a look at it right now, the math is simple. We've got 9 years to achieve those 169 targets. Where are we? And how far along have we become? Next slide, please, Isabella. Well, let's just take a look at 3 of them. If you look at the bottom one, the COVID-19 pandemic, one of the things we have learned is we're not as prepared as we thought we were. If you look back, if you remember the Ebola crisis back in 2014, that actually precipitated the world, right, to think, we're not ready for a big pandemic, let's get prepared. So a global health security agenda was put together to prevent, detect, and respond to infectious diseases. That was a good thing. It involved governments, academia, the private sectors, large intergovernmental agencies. They got together and they started to build a very important coalition to prevent the next pandemic. Now, COVID hit. What did we see? We obviously thought we were better prepared than we were, but COVID has obviously shone a bright light in what we've done well, but more importantly, what we're not doing well. And I think that it has hopefully given us pause for thought that despite being, in the partway into the 21st century, we're still woefully unable to deal with the pandemic that occurs today and future pandemics that will surely occur. On the left screen, you can see that the biodiversity crisis that has occurred. Now, back in 2010, there was a big meeting in Aichi, Japan, where the world got together and said, look, we're going to lose 1 out of 8 species and possibly 1 out of 6 species on the planet. Why is that important? Well, where you live in Brazil, that those species, we're part of actually a network of biodiversity on the planet. As those species are running extinct, as the numbers actually decline, and as the species go extinct, we're running into some serious problems because many people live in Brazil and in other countries around the world. We rely on the biodiversity of the planet. And as we are destroying that biodiversity, we're destroying our food security. And in fact, more than 1.3 billion people in the world rely on coastal areas on the biodiversity of the oceans alone. So what that's going to do is it's tearing apart the foundations of development. And the interesting thing about it, I would argue that the biodiversity crisis is even more of a threat than the climate change crisis, because once species go extinct, once you remove those species out of the ecosystem, they're gone forever. Extinction is forever. If you take bees, for example, which are really vital, and other pollinators, they're responsible for 70% of the foods we eat. If you get rid of them, and they are declining rapidly, you run a serious risk of not being able to pollinate the foods we rely on to eat. But this is an issue that's neglected. So when they came together in Japan in 2010, in Aichi, they created 20 targets. I said, these are the 20 targets we have to achieve. Countries agreed to it. Fast track forward to 2020, the world met again and said, okay, how are we doing on those targets? What happened? They found out that of the 20 targets, guess how many had been met? 0. Not one of those targets had been met. Finally, let's look at the climate change conference. COP26 took place in Glasgow, and I think all of us paid pretty close attention to what was going on. There was obviously great aspiration and hope for what would happen. But if you take a look at where we are today, if you ask yourself the question, of the commitments we make today, how do those commitments rate in terms of what we need to do to deal with our goal? Our goal being keeping global warming below 1.5 degrees centigrade by 2030. And in order to do that, you've got to reduce carbon emissions globally by 50%. So where are we today? If you took a look at all of the commitments in the world, right, to be able to reduce carbon emissions, what percentage of that is what we need to, are we compared to what we need to do? It's only 25%. 25% is all we're at in current commitments to actually achieve a 50% reduction by 2030. So this is obviously a critical, vital issue. Now, if you ask yourself why that's so, there were a lot of hope and aspirations in Glasgow, but I think you've got to look at the architecture of how these agreements take place. Those targets that people agreed to, that they go, fantastic, we're going to reduce our targets by X percent. They're not obligatory, they're voluntary. The problem with voluntary targets is that they almost always fail. It's just too easy not to fulfill them. There's no penalty to not fulfilling them, and there are no incentives to actually do that unless those incentives are domestic. So here you have a challenge. Countries come to meetings, they agree to making targets, voluntary targets. People go away and saying, fantastic. But in reality, as you can see, as time passes, are those targets met? The answer is no, they're not. And they fail miserably. But hope is not lost. The interesting thing is, if you look at it, and a lot of the discussions around Glasgow was money for low-income countries to support their efforts to be able to adapt to climate change. And all of that is good and necessary. But that was hiding the real issue. The drivers of climate change are really 20 countries. 20 countries in the world, mostly rich countries, they're responsible for 80% of the carbon dioxide equivalents being shot in the air. But who pays the price? It is true, lower income countries will pay the greatest price of all, and the poor around the world will pay the greatest price for that. So if you wanted to actually deal with climate change rapidly, it's an interesting thing. If you focused on the 20 countries that are responsible for 80% of carbon dioxide emissions, you could do a lot. And here's the other interesting thing. There are only four sectors that are responsible for 86% of those carbon dioxide emissions. That's fascinating because that provides, right? You've got a smaller target that can be addressed to be able to have a significant impact on reducing those carbon dioxide emissions. And what, from our perspective, we had and I'd encourage you to take a look at our website at cugh.org. On October the 15th, we brought together wonderful representatives from the UN Environment Program. We brought the head of the UN Development Program, Achim Steiner, who spoke at the conference, the WHO and others, the Caribbean. We brought together leaders from around the world to showcase how is climate change impacting the world and what can we do about addressing those now. So the results of that are on our website. Please take a look at it. So what we're moving forward with doing is hopefully mobilizing our 182 members and 32,000 person network, working together to advance the policy solutions and the advocacy that is necessary to deal with the climate crisis. So that's where we are with that. But I think it gives us false hope and false security if we are going to rely right now on big international agreements, because those conference meetings, the actual final agreement is not a majority position. It's a consensus position. So it always falls to the lowest common denominator. And that's what you're going to get out of it. Now, none of that precludes the ability of or capacity of a country to do this on their own. And there are very strong arguments that countries that pursue these changes themselves will be able to have a significant impact for their country, for their citizens, economically, from a health perspective, and socially. So the incentives are there. We actually know how to deal with most of these issues, and there are great opportunities to do that. And we'll explore that in a little bit. May I have the next slide, please, Isabella? But I think there's an issue in development that I'd like you to take a look at and consider. If you look at the world's poorest countries or any particular issue, in development, we often look at the top target on the top, right? The Sustainable Development Goal. Are we dealing with heart disease? Are we dealing with diabetes? Are we dealing with food security? Are we dealing with a very specific? Are we dealing with malaria? Or water security? We'll be putting into programs that actually deal with a specific issue, which is very important. But think of it this way: if you want to put in a water program or start up a training program for community health workers, right? What do you need to be able to do that? You need to have effective public institutions. So let's take a look at what are the foundations for being able to act out, implement, and sustain projects that actually address the Sustainable Development Goals. And this, I would argue to you, is where we actually fall apart. You've got to have effective public institutions. If you're going to train healthcare workers, if you're going to be able to do the health programs we know, you've got to have an effective health system, right? If you don't have an effective health system, if you don't have the people and the management capacity and the money to be able to do that, you'll never sustain that at all. It's an interesting thing. I had a meeting with former minister from West Africa. And that country is one of the most affected countries by the Ebola crisis. And this was just around that time. And I asked him, I said, what's the most important thing your country in West Africa, one of the poorest countries in the world, what's the one thing that your country needs to be able to improve the health and welfare of its people? Now, I thought more nurses, more doctors, more community health workers. Wasn't that at all. He said, I need roads. I stood back a little bit. I said, roads? He said, yes, because we have clinics, but 60% of the year, our roads are washed out because of rain. So if somebody's sick, if a woman is having a baby or she's in trouble in labor, how does she get to a hospital or a clinic, to a healthcare provider, if the road is washed out? And for 60% of the year, the roads are washed out. So sick people were not able to get to the clinics, as rudimentary as many of them are, even if they exist. So it's really interesting to see that there's an ecosystem, right, of things we don't necessarily think about. I'm a physician, but a lot of our colleagues are not really thinking about things that we need beyond what we need. So we need effective infrastructure, right? You need to be able to have effective departments in education or the environment. If you're going to address environmental issues, you've got to have a good environmental department, right? And then underneath that, you've got to have a competent, transparent finance department that's able to take the resources of the country and apply them through the institutions to address those sustainable development goals. And an important justice system to be able to enforce the laws. I'm Canadian. There are mining companies in my country that go all over the world, and they commit some atrocious acts, polluting parts of the world and leaving really a mess behind them. And there's no justice. They do this with impunity. So you got to have a country also obviously has to have an effective justice department to be able to enforce the laws to protect the citizens. And finally, oversight, an independent electoral system, press freedom, and oversight mechanisms. You know, and I know, if you don't have those, bad things can happen. And bad actors can actually do bad things. And we're seeing this around the world right now with the rise of some political movements that are engaging in some atrocious behavior against their own citizens. The citizens don't have recourse if you don't have an independent justice system that can protect their interests and their rights, and you don't have a free press that's able to go and report that. And journalists around the world are actually subject in some countries to to abuse and sometimes murder. So these are issues that are important. Here in the United States, we're seeing an unraveling of the electoral system. We're seeing significant abuses here in the United States in terms of people's voting rights. And who would have thought that this democracy in the richest country in the world is actually sustaining that? So the principle, I think, for all of us to, keep remembering is that democracy is a fragile creature. It needs to be tended, it needs to be strengthened, and it needs to be protected. And sometimes in global health, it's not something we necessarily think about as important, but it's more vital because without those foundations on this graph, the Sustainable Development Goals will not be achieved. May I have the next slide, please, Isabella? So what are the consequences of failing to address those foundations of development? As I said, it produces weak governance, corruption. Now, we all go to a lot of meetings, and it's kind of interesting when he talks about funding development. Official development assistance is about $148 billion a year. But money lost to corruption is an order of magnitude larger than that, $1.5 trillion a year. Much of those monies are coming out of low and middle income countries, and they're being reposited in high income countries, in Europe, in the United States, in North America. And that money is being held now, money that belongs to low and middle income countries. And those countries can't get that money back. They're being stored in real estate, in banks, they're hidden, and they're not being given back. And this is the big challenge that needs to be brought forward. Hopefully we'll have some good news shortly, because at our conference in 2019, Our keynote address was a former Peruvian Minister of Health who I asked to speak about this issue, and she did an amazing job informing the attendees, over 1,500 attendees, about the impacts, her challenges as a Minister of Health in Peru, and what she faced with in terms of trying to do her job as a physician and as a minister, and how corruption really, the impact of corruption really undermined her ability to do the right thing for her people. It was so popular. It was the most popular session at our conference because people just, at least in global health, they ignore this issue. But this is where the money is, because if you could liberate this money, it can be used for the public goods that belongs to the people anyway. These monies belong to the people in low and middle income countries, and they've been taken from them, and they are continuing to be taken from them now. So it's an issue that we'll talk about. We would really like to work together on dealing with this. And then it's impacting deep disparities. When you have weak governance, if you're not able to address the sustainable development goals, disparities start to widen. I think all of us know that that gap between the rich and the poor is actually widening, and the middle class is shrinking. A really serious challenge, and it's unnecessary, and it's getting worse. All of that leads to state instability, and as I mentioned, human rights abuses. And importantly, failure to deliver the public goods that people want, and thus a failure to achieve the sustainable development goals. And I just, hopefully when we finish this talk, if there's one driving message that one of the key messages I'd like you to think about is think about that pyramid of development and think about how we can strengthen the foundation of development, which is really the tools, the mechanisms that enable the great people who are trying to do a good job in their countries to be able to serve the public. Next slide, please, Isabella. Do you have the next slide, please, Isabella? Thank you. So what are our opportunities for academia, which Professor Safi had asked me to take a look at with you? Well, let's take a look at the core issues. On the issue of education, in curricula, I think there's a lot of curricular reform that needs to take place. And one of the things we're doing at CUGH, as you are, is how can we bring together different disciplines in being able to train people? Because we know if you're dealing with infectious diseases, we know that, for example, in the case of COVID, the generator of that, the generation, if you look upstream, what happened, that was an interface between a wild creature and a human being. And as we're destroying ecosystems, those opportunities for spillover are increasing. The trafficking of wildlife, wet markets that are unregulated, are all hotspots for spillover of diseases. So in dealing with the problems, right, we might look in medicine at looking at those infectious diseases and say, well, how can we deal with Zika? How can we deal with yellow fever? But we also have to be trained and to understand the environmental drivers of these, and also the interplay between what those diseases are to people. Let's look at the big area in terms of health that are neglected, non-communicable diseases. Infectious diseases have dominated global health for a very long time. But if you ask yourself the question, what are the major killers of people on the planet? It's non-communicable diseases. 70% of deaths, mortality, are due to non-communicable diseases like diabetes, cardiovascular disease, lung disorders. Mental health is the leading cause of disability in the world. And you've got trauma and injury, which is utterly neglected in many ways, and implies that we have to look at health systems for both public health, primary care, and access to quality surgery. Surgery gets left out, but we're never going to be able to have a competent health system unless people are able to have access to quality surgery. So reforming education. An interesting thing about this, in terms of how we educate, is there are opportunities for experiential learning, experiential service learning. Let me give you an example, which I found really fascinating. I was giving a talk at the American Association of Veterinary Medical Colleges, veterinarians. I was walking by the posters. I saw a poster and it was by a dentist, actually a dental student. I stopped and I asked, I said, so what would a dental student be doing at a conference for veterinarians. And she said, well, this is what we did, Dr. Martin. This is in Texas. Poor places in Texas, they obviously, people who are poor, they're not getting access to the care for their pets, and they're not getting a lot of other care for themselves. So what this intrepid school did is that they took the senior veterinarian students and they said to these poor communities, they said, you love your pets? Yes. Would you like us to give you some basic veterinary care that will be provided with oversight by veterinarians, primary care for your dogs and cats and other pets? They said, we'd love to. Well, what else did they do? They actually brought in the fourth-year dental students. So they also said, and by the way, if you'd like to get dental care, and dental care is not covered in this country, would you like to do that? These people would not be getting dental care. So they brought together teams of senior veterinary students to take care of people's pets. That was the entry point. And dental students that were giving these people primary dental care in their communities that they would never have access to. So it was wonderful for the students. They got to be able to actually learn and practice their craft in their final year, exercise what they learned to do under supervision, provide service to communities in need, but importantly, learn from another discipline that they would never mix with. And by being able to mix and learn from, and you could do anything. You could put nursing students, physicians, trainers. You could put law students. You could do any mix you wanted to. In engineers working on water security. Imagine mixing those together, giving those students experiential service learning opportunities in their communities, in their countries. It's a win-win-win situation, right? The community gets a service. The people who would never get those services improve their lives. The students get real-world experience in being able to exercise their craft at the end of their training, something they would be doing anyway. And it would all be under supervision. So, and they get to learn from each other in an interdisciplinary way, thinking about, well, what are those engineers doing for water security and fluoridation? And how does that impact my work as a dental student? Really important, right? The combinations are endless and the possibilities are fascinating. But in doing that in education, in reforming our education programs, we can do a lot to provide new training opportunities. In research, well, as a colleague of mine said in one of his speeches about research in terms of getting your research published, vitally important. He said, but once you get that published, that is not the end. It's not the beginning of the end. It's the end of the beginning. So we have to think of ourselves, how are we going to get, and I would ask you, before you start a research project, we try to impart this upon our members. Please think about what is the impact you're going to try to have. You're using your considerable brain power and resources to have an impact. Think about how that what you do is going to impact people's lives. Are you aligning your research with the needs of communities? And we can do some fascinating relationships between academia and government, academia and community, academia and the private sector, to be able to use the incredible research power within academia to align themselves with real world problems. And at CUGH, what we have done is we have created a capacity building, a crowdsourcing site for research questions. We are inviting governments and the private sector to put those questions up in the hopes that master's and PhD students will be able to say, oh, I think I'll apply to that company to do their research for them. They'll get high quality research, something that's needed, and that student will be able to build a relationship up with an institution. Finally, on the issue of advocacy, something that's, I know there's not an incentive in academia to do advocacy, but I used to be in Parliament, and I can tell you what used to happen is that colleagues of mine would come in because of one of 5 physicians in Canada who are members of Parliament, so there are very few of us. So we were a bit of an interface between our colleagues and the science community. But what would happen is that many of my colleagues would come in with tomes of research papers, bricks that are this thick, and saying, oh, please give this to the minister to read. no minister is going to read that. It's just not going to happen. So we have to be able to be clever about how are we going to take our wonderful work that you're producing, put it into a package that's actually going to be understandable, usable, and importantly evoke not only an effect up here, but it's more important to even evoke an effect in the heart, right? An emotional response to what we see will make people remember it and hopefully make people care about it and therefore act on it. So I think we have to be a lot more creative in academia as to how we're communicating the work that we are going to be doing. And finally, on partnerships, what we're doing at CUGH is we're trying to align the capacity in academia with very specific efforts to build capacity in low resource settings, particularly on the training side, to be able to provide trainers with training institutions. And I'll get to that in a second. Next slide, please. So here's some of the academic partnerships that Dr. Safi asked me to share with you. I would encourage you to take a look at the Toronto Addis Ababa academic collaboration. This happened because at that time in Ethiopia, they didn't have any psychiatric training facilities. They didn't have any trainers. So they approached the University of Toronto, my alma mater, and Dr. Claire Payne to see how they could do that. Fast track forward, the University of Toronto provided trainers that trained the first cohorts of mental health care professionals in Ethiopia and helped them to become their own trainers. Now it's an utterly self-sustaining program where Ethiopia is providing their own mental health care providers, and that's expanded to other disciplines in primary care, in nursing, and in other disciplines. So it's been really exciting to see that take place. We also built a relationship up with other consortia. And one of those is the African Forum for Research and Education in Health. Their office is in Kumasi, Ghana. They have about 42 institutions. And we've created a working group with them to be able to assist them where they want, make sure that their work is actually shared worldwide, but really work with them to strengthen their efforts as a consortium of academic institutions. And we'd really like to do that with the ALISAG, which is a Latin American consortium that's just starting up and I think getting its feet on their feet. I mentioned the other, I'll be quick about this, with the Harvard University and our capacity building committee under Dr. Bihari. We're working with Sierra Leone to build their mental health care human resources. That entire country has 2 psychiatrists, no psychologists, and 3 mental health care nurses. And that's a country that's endured Ebola and a brutal conflict that killed 250,000 people. So we're trying to we're working with them and with Partners in Health to be able to build, like what happened in Ethiopia, build their own capacity to strengthen their own mental health care training facility. Finally, domestically, we work with the Centers for Disease Control, and we have a fellowship program with them. It's only for U.S. members, but I bring this as an example because it's a way that academic institutions within their own country can work with government to be able to match academia's capacity with a government need. In this case, the Centers for Disease Control wants to strengthen their training capabilities. They want to find new young recruits. So we're actually working with them, and I run a fellowship program with them and the Public Health Institute to create a cohort, a pipeline of public health professionals for the CDC. Next slide, please, Isabella. So what are our opportunities in CUGH in Latin America? ALISAG and CUGH, we'd really like to strengthen that relationship with a consortium of institutions in Latin America. With individual institutions, we worked with INSP in Mexico on showcasing their great work on addressing obesity and food security issues. They were a co-chair of our conference, in fact, last year. Colombia and Mexico, we're working with institutions in South America and Central America, Mexico, to stop the flow of weapons from the United States into Central and South America, which you all know is infinitely better than I, how devastating that has been. So the U.S. has a major pipeline of flowing millions of weapons into Latin America, which has been just hugely destabilizing, is killing tens of thousands of people, and we're determined to stop it. So we've built a group of, we're working with institutions here in the US and others in Latin America to stop that flow of weapons that are killing so many people in your part of the world. And finally, I mentioned the work with Peru on anti-corruption work. Next slide, please. So future opportunities, as I mentioned before, ALSAG and CUGH, building individual institutional partnerships, capacity building, using us as a vehicle to share your work, and this Congress, your Congress, as I mentioned earlier, to your wonderful organizers, we would be delighted to share your Congress with the world, with our 32,000 members, and we will do that. On climate change and biodiversity, Amazonia, 20%, you know, is being massively degraded, with huge implications for Brazil in terms of water security and biodiversity losses, food security, and more. That Amazonia is so vital to all of our health and the planet's health. We'd love to work with you to be able to learn what you're doing to address that challenge, share what's happening with members around the world. NCDs, anti-corruption, pandemic prevention, and gun violence, those issues we mentioned. So there's a lot more, but we would obviously like to know how we could partner with you, with your individual institutions, and with ALSAG as a consortium around the world. I should say we do work with Caribbean nations, and we have a wonderful board member who was born in Suriname. She's now the Dean of Public Health Pittsburgh. She's the Dean of Public Health in Pittsburgh, Maureen Lickfield, and we're working with her on this issue and a few others. So next slide, please, Isabella. So I mentioned this before. I'm not going to belabor this. We'll get into maybe questions, climate change and biodiversity crisis. Next slide, please, Isabella. And then I just wanted to show the slide, which you know so well, the dark red over Central Latin America. That's the highest homicide rates in the world. This country, the United States, is contributing massively to that problem. And know that you have an ally here at CUGH is working hard with members in Latin America to stop this. We need your help. We're there to support what you're doing. We want to support what you're doing, and we want to work with you to be able to, address this area of deep insecurity, violence, and terrorism that's actually terrorizing citizens and civilians throughout the region. So just wanted to say that we're there to be your ally in trying to stop this. Next slide, please. So I'm inviting you all to come to our virtual conference, which is going to be next March. I should say that it's still open for satellite sessions, which we have. We run these half-day sessions. They're free and open to all. And people can submit a proposal to run a half-day session. We're going into our 10th Global Cancer Day with the 10th year with the National Cancer Institute on addressing cancer. And we've done work on climate change, environmental issues, on addressing the global, on surgical ecosystem, trauma prevention, and much more. And I think we're going to have our second global child health panel satellite coming up. But this is just a great way for us to roll up our sleeves. They're 3 hours or 6 hours in duration. They can be split over 2 days. But it's just a good way to bring people together, roll up our sleeves, and come up with some plans of action that we can take to address these challenges. Next and final slide, please, Isabella. So I wanted to I brought this slide because I'm just such a huge fan of Bolsa Familia. And I just use it as a Brazilian example of innovation, excellence, and poverty reduction, of one of many, obviously. But I just really wanted to know that we want to learn so much from the great work that all of you are doing. The world needs to know what you're doing. We want to share what you're doing, and we want to be a good partner with you to deal, as Professor Safi said, I don't want to be maudlin about it, but to make the world a better place, right, for all. And that's what we're all trying to do. So, obrigado Thank you for your time, and I will turn it back to Professor Mara and Professor Anna Beatriz. So we'll have a discussion and get to Q&A. Thank you so much.
Thank you so much, Dr. Martin. It was a very exciting presentation and makes us think about our role in society, in the world. And so we received some questions. First of all, it was very important that institutions' development plans include actions that contribute to achieve the Sustainable Development Goals of the United Nations 2030 Agenda. And in this sense, in my opinion, universities have a paramount role in addressing the SDGs and building awareness about the 2030 Agenda, that is, educating citizens towards a more sustainable world. And many people see the university only related to SDG 4, which is education, quality education. However, again, from my point of view, as you clearly show here, the universities are related directly or indirectly to all the sustainable development goals, especially through partnerships. In case of UFSPA, also related to SDG 3, health. And we cannot forget that education is the path to a better life quality, to decrease inequalities, and to improve everybody's life. And as you mentioned, the COVID-19 pandemic that we are going through right now increase inequalities. And related to this issue, to increase in inequalities, we have a question delivered by Professor Ayrton Stein from UFSPA. And so his question is, how to manage increasing social inequalities everywhere, especially in Brazil after COVID-19 pandemic? We have to be aware that there are several conflicts of interest that play a big role to define the world's agenda.
Well, thank you so much for your question. And I'm glad that you brought in the issue of public awareness. I think one of the challenges I found as a parliamentarian is that there's a lack of understanding on the part of the academic community writ large to understand how politicians work. We do not align our offers to assist our what we're asking politicians to do and align them with their own interests, right? In the sense that we've got to understand they want to get elected or re-elected, right? They do have many, many competing interests to deal with. And so I think we have to, and at the end of the day, in many cases, it's what does it happen in your own community, right? You're answerable to your own constituents. How does what you're asking a politician to do relate to their own constituents? And then they may have their own personal interests too. So assuming that it's an honest person that you're dealing with, that they're trying to do the right thing, that you have to, I think, understand what their incentives are to get elected, and how do you frame what we're asking them to do in the context of what are you asking me to do? How do you want me to do it? Who's going to pay for it? What is it going to cost? These are things we have to provide for them, not in a big booklet, but we have to make it really, really slim. There's the old adage, right? It's called the no paperclip rule. The no paperclip rule means it can only be on one page, back and front, but something you don't need to use a paperclip to communicate with them. If you can do that, you're communicating something, hopefully in a useful way. The second part, and you brought it up, which is important, is dealing with the public. You've got to inform the public. You've got to create coalitions in the public. The public moves the political. And you've also got to get it into the media. The media is powerful, right? We've seen this right now in terms of the use of either traditional or non-traditional media, the power of disinformation to upset what we're all trying to do in terms of dealing with fact-based approaches. So we've got to be able to understand how that happens and be able to communicate through traditional and non-traditional media and communicate directly to the public, to mobilize them to care about the problem and give them something to support. So, but that's something that academia tends not to do very well, and we need to do a better job of doing that. I think if you do that, then you're going to be able to deal with the disparities issues.
Great.
Thank you very much, Keith. We have a lot of comments and questions, so we are here trying to organize. I have a comment from Professor Melissa. She says, thank you so much for a broad and yet in-depth view of our global health issues. And we have also a question from Bernardo. How to foster faculty awareness of the need for training students for advocacy?
Well, thank you very much, Bernardo, for your question. It is, you're correct. It is, we are missing in action in terms of how to do that. We at CGH, I would encourage you to look at, we do two things. We run with the Pulitzer Center for Crisis Reporting. We run a workshop on training for advocacy, and it's free. So at our conference, you can sign up for it, whether you're a part of the conference or not, and avail yourself of those training opportunities. It's actually on our website too. So use those tools that we have from the Pulitzer Center for Crisis Reporting. You can contact them directly. They will give you tools to use. There's also something called First Draft News. First Draft News is a group that will help to understand how to deal with disinformation. They have offices in New York and in the United Kingdom. They're academic based, but First Draft News will give you the tools you can share with your students and how to deal with disinformation and therefore communicate. Finally, on the issue of academia, we have to change, I think, a bit of the incentive structure. And I think, communicating and becoming a public scientist, which I would argue is more important now than ever, to be able to be out there in the public, engaging the public in the media. You're not incentivized to do that. We've got to be able to, my personal view, is that part of being on a tenure track and getting tenure, we've got to add other actions, I think, to be able to reward academics that are doing the work that Professor Safi, Professor Anna, and Professor Mara and others are doing, to be able to, be out and being able to share all the great work you're all doing in the public. So, but I think you need to incentivize academics to do that. So I believe that part of tenure track should include your ability to engage the public, engage politicians. What are the partnerships that you're building? Have you created good partnerships? Are you being creative in terms of how you're training your students? Is there a service component? The service component in academia is the runt of the litter, right? It's not really, it's left off to the side. But as I mentioned, I think we can be really creative at an incredible value proposition for your students and attracting really good faculty who can be creative in how we're able to use the education mandate of academia to address the challenges before us and create a better, smarter, more effective citizenry, which is one of the goals of academia.
It is a great challenge for us professors. And we have a collaborator that you know who's watching on YouTube, Professor Freddy Pettis, who's from the Pan American Health Organization. He's a collaborator of UFCSPA and also of our Global Health course that Professor Ayrton, Professor Mara, Professor Elena Barros, and I give every year to our students. So Freddy sent this message. Hi, Keith. Thanks for the great lecture. Please comment on what is still needed to have a sustainable Latin America active global health network of universities that can work together in improving curriculum that consider multidisciplinary topics that you have presented. A South-to-South collaboration approach for effective public institutions. Also, what is for you the two of the three main factors that enables for connecting universities and communities. Thank you, Freddie Pajo.
Well, it's great to hear from Dr. Perez and Dr. Safi and I met in Pajo. And so it was his office that, right, Jennifer, that we met with. So Freddie is responsible in part for this wonderful burgeoning relationship that we all have. So thank you very much, Freddie, for that. So I think the first thing on the network question, it's far be it for me to actually say what's needed at all. But if I could make some observations and suggestions for what it's worth, I would hope that ALISAG would be able to have a home, a physical home, that because I think it's really important. Well, I can just share what we learned. So CUGH, we opened up the office here in 2012, and that's when I was hired. But the board before that said, we've got to have a permanent home. You can't have a consortium of universities for global health kind of partially here in a university at the University of California, San Francisco. You got to professionalize the organization and give it a home. So the board said, we're going to have one here in Washington, D.C., it's the capital. Similarly, for the AfriHealth, the African Forum for Research and Education and Health, I mentioned we've been with them since before they were born, and it's been really interesting to see how they evolve and work quickly to create a permanent mechanism and a successful one that's growing all the time. So what we both learned, AfriHealth and CUGH, is we learned you've got to have a physical structure, Freddie. ALISAG has got to have a home. It has to have a physical, permanent home that's not going to move. And then you can hire a team, an executive director, a few people to be able to build the organization, build the partnerships. If you can do those two, and then have some funding, some seed funding that can last, 3 to 5 years. We had some seed funding to start off with, but we became self-sufficient in about, we got out of a debt situation after about 3 to 4 years, a couple of years ahead of schedule. And we're self-sustaining now. But I think you have to be able to have a permanent home, and you can make a decision to hire an executive director, some staff, have a board representative of Latin American institutions, and others. Bring in some folks from, as you mentioned, from the global South. Maybe bring in 1 or 2 from the global North. But you can bring us together, and that's what. It's more important for ALISAG to do this than CUGH to do it. We'd be happy to be bit players on the side, do whatever you want. But if you can do those, that would be wonderful. But I would just, anybody listening, to give ALISAG a home and to do that and give, it won't cost a lot of money, but give the organization 3 to 5 years of seed funding. Then you're going to be you'll be on a roll. Then you're going to move forward in the sense that you'll have that structure. So
can I just make a comment on that? Because first of all, say hello to Freddie, that I'm very glad that he's joining us today as well. And you heard Freddie, what Keith just said. So I think we three here. So Keith, Freddie, and us, and also WHO. Yesterday we had Tina Punat from WHO. I guess we do have a very big role here, and if you work together, we really can make a big difference. And I think we should take this opportunity based on what you just said, Keith, to have a home here in Adel American. And I think Pajo can also help us to make these bridges, to help us how to get this group and start. I mean, we can start small, but we do need to make this happen. And I'm very, very happy that you mentioned that several times, Kid, about this meeting next year. And I think we really need to have a section on Latin America global health opportunities from your meeting as well. So I just want to say that we have this responsibility to move this forward, and you can count on us. Okay.
And Jim, if I get add one thing to add to a couple of things. One is on our board, we have allocated a spot as an ex officio member on our board for ALISAG. So that spot remains open. Once ALISAG is created, we will be honored if a representative from ALISAG sat on our board, just like the Centers for Disease Control, the National Institutes for Health, the Lancet, they're all on our board as ex officios, but we have a spot reserved for ALISAG, and we're really hopeful that comes to pass. And as I said to AfriHealth, they said, can you give us whatever you have? So I said, whatever we have, if it's of use, it's yours. So we, the operating procedures, all the functional stuff, if it's any help whatsoever, if you ever need any of that, we'll share whatever we have with the ALISAG leadership. So, and creating space at our conference, you said, Jennifer, we would love it if ALISAG, even for, the conference is virtual in March, entirely virtual.
Yeah.
We changed it. It was going to be in Los Angeles, but because of the pandemic, because of obstacles to our colleagues around the world to attend our conference, we said, we can't do this. It's not equitable. So we went full virtual. And so you can run a satellite session from anywhere in the world. You can run it from Porto Alegre.
Yes, and these two ladies, Ana, Mara, Rúbia, and also Professor Arito and Helena, they are doing a great job here in this sense. So it's up to you. It's on us now.
and the course has been increasing the number of participants.
Yeah.
The first year we have like 5 or 6, and then 12. This year we had more than 40.
Congratulations.
It's been great. And it's all in English. So you're going to be invited soon to deliver a lecture for us.
That would be a dream.
Go ahead, ladies.
Well, thank you very much, Keith. I have a comment. I loved to hear you mentioning the importance of experiential learning. Right now, we are exactly bringing to the university in the US 2 projects that are project-based learning. So we have this young students with creativity, passion. So we needed to give them an opportunity to have a voice, and actually we will learn from them. And I also like with our Vice President, Safi, mentioned to do small things. These projects are small, but each one of us can do something in order to have health people, health planets, and social justice. We have many more comments. One comes from Professor Elena, another colleague of us involved in our global health course. And Elena commented that we have a large group interested in neuroscience and mental health. Sorry. And we have also another question from Professor Melissa Fortes. Melissa is asking, on July 20, this last year, The Lancet published a comment article on COVID-19 challenges to an inclusive and sustainable global future. What would you say are our main challenges post-COVID for an inclusive and sustainable global future?
Well, thank you very much, Professor Elena. And just to go back to the first comment, we're happy to share what the work we're doing in mental health training. And I would look at, and I can share with you the work that Professor Dr. Payne did with Ethiopia in terms of building mental health care services. If we can email offline, and Professor Safi or Professor Anna or Professor Mara will connect us by email. And I'm happy to share that with you if for your students. So on so that's Professor Elena. So Professor Melissa, that's a great question. If you look at the response, so we did a webinar actually early on in the pandemic, and we wanted to showcase countries that were doing really well early in the pandemic. and by extension showing what countries were not doing well and why that was so. So we featured Taiwan, Hong Kong, and will come to me a third country. In any event, the reason why those countries did well, it wasn't a relationship to the money you have, because if that was the case, the United States, which spends 50% more money than any other country on healthcare, would have done well. But instead, the United States has done nearly the worst. It was also the most prepared country before the pandemic to deal with the pandemic. So what we learned is that all of that stuff, how much money you have in the bank, the kind of money you spend on healthcare, the infrastructure you have, those weren't the most important issues. There were other issues, political issues, social issues. Does a country come together as its people and say, we have a responsibility to each other as human beings, and I'm going to do what I need to protect you because I feel that's my social responsibility. I'm going to wear a mask. I'm going to get vaccinated because I care about you and I want to protect you, and I think that's our responsibility. Also, do they have faith in their government? Do they trust their government? So these are things that people never thought about or didn't pick up before before COVID, but now we know that's really important. The other issue, of course, we're seeing with vaccine equity. We've seen a miserable, horrible, appalling behavior on the part of high-income countries to guard, and I understand why they're guarding the intellectual property, but I also don't understand that that's clearly not necessary, particularly since that intellectual property was paid for by the taxpayers, right? That intellectual property for the Moderna and Pfizer vaccines was funded by the taxpayer, not by the companies. So they're already making billions of dollars. Not sharing that intellectual property with producers around the world is important. So I think what we have to do in the future is go back to the global health security agenda. It's got a really good mechanism. I'm not a favor of it. I'm not a fan or in favor of pursuing a treaty. I know there's a lot of talk about pursuing a pandemic treaty. I'm not in favor of it because treaties are voluntary. They take a long time to be passed and even a longer time to be ratified. And there's no mechanism to put them into force. So you can talk a lot, it'll take a lot of time, but at the end of the day, we're not going to be further ahead as we are now. So use the existing structure of the global health security agenda and strengthen that infrastructure, right? So that includes strengthening public healthcare systems around the world. Interestingly enough, not only will you be able to be more effective at pandemic prevention, but being able to strengthen your public health will do what? It's going to hit your non-communicable diseases. It's going to enable us to prevent those diseases that are actually causing 70% and growing mortality in the world and the highest cause of morbidity. So the other thing is we've got to reform the ability for us globally to communicate more effectively with each other. We also have to deal with the issue of not penalizing countries, as we're seeing in South Africa for picking up the Omicron variant. If you do the right thing, you should not be penalized for doing the right thing and announcing we found a deadly disease. Don't go on and isolate that country because that harms them. And the evidence shows that travel bans they really don't work. They might buy you a bit of time, but they do more harm than good. So I think that strengthening public health, being able to have a fund, a rapid fund that you can deploy in the case of an epidemic, being able to strengthen the human and physical infrastructure in countries, all of that's going to be pretty important. And academia has an important role to play in all of those spaces, particularly on the human resources capacity side, and strengthening ministries, government ministries to have the capacity, the management capacity to respond effectively. And finally, we have to deal with the loss of ecosystems. The destruction of ecosystems is putting us closer and closer to the deadly diseases that are harbored within the natural world. As we destroy the natural world, the spillover risk increases. Interestingly enough, if we protect ecosystems, the value of those, and they're called nature-based solutions, produce all kinds of opportunities to address the social determinants of health. I mean, briefly, I used to work in volunteer in South Africa on conservation projects, particularly rhino conservation. And what's interesting is that you can take reserves and you can use ecotourism and other opportunities to generate large sums of money. The important thing is you've got to share that with the communities that live around those areas, and that's not happening in many cases. But if you do that, you will have a perpetual, eternal source of revenue, working with indigenous peoples that live near those reserves to help manage them, protect them. And if you protect those ecosystem services, the value to a country, to its citizens, vastly exceed anything you can get from wiping out those and degrading those habitats. You're also protecting your country from spillover events. So we've got to look at the UNEP, UN Environment Programs, nature-based solutions. Those are the kind of projects we need to do. And if we can mainstream conservation to sustainable development in Brazil, I am confident that Latin America, you can lead us and teach us how to do this well. You and obviously the Central Africa are the major areas that are the lifeblood of the planet, and we can learn a lot from you in how we can, mainstream conservation to sustainable development that protects those critical ecosystems in Latin America, on the continent of Africa, and in doing so, it can be a source of pandemic prevention, but also addressing the social determinants of health. And it wouldn't be a draw on the purse, on the central purse. But we got to show leadership and be clever, I think, about how to do that. And there's a lot of opportunities there, which we'd love to work with you on.
It's great to hear you say that. I've been working with the One Health approach for a while, and yesterday we had a session in the Congress that was environmental change and the impact in the emergence of infectious disease. And it was a great discussion, and it has all to do with what you were just mentioning. And I think that UFCSPA, especially considering it's a federal university in a country, of a continental-sized country like Brazil, with so much biodiversity and so many different environments, it has a really important role. Even though it's in the opposite side from the Amazon forest, we have such unique environments in the south of Brazil, and we could really contribute in addressing all this environmental conservation and guarantee the sustainability of our environment. And so now we have some more questions from the audience. This question was from Julia Souza da Costa. And so she's congratulating of such an important lecture. Your statements on Brazil's trajectory against poverty, especially the Bolsa Família program, were providential. We are living a difficult moment in which this important public policy, for instance, was extinguished. I'd like you to comment, if you may, if you see austerity actions like those we are experiencing in Brazil as a global trend and a global threat. I would also complete, not only a global trend, but also a global threat.
Thank you, Anna. Thank you, Julia. I was, if you look at Bolsa Família, and you know this infinitely better than I, Julia, and you look at the political spectrum, center left, center right, at least right-wing think tanks, at least in North America, and you looked at Bolsa Família, and they thought this was a great idea. They supported it, right? So you had academic organizations, think tanks from the right to the left, came together around Bolsa Família and said, this is a clever use of the taxpayers' money that actually kept kids in school, provided incredible resources to families in need, had incredible social good, improved the health of people. The rate of return on Bolsa Família was significant. So it's such a wise investment. I think it's really, one of the threats we've seen is the rise of a more nativist political movement on the right that have actually taken measures that can harm the poor. There's a war on the poor, I would argue, in many parts of the world. We certainly saw it here. We're seeing it in other parts of the world. And marginal communities, disadvantaged communities, the poor, even the middle class in many cases, are being disadvantaged to the advantage of the rich. Now, I'm not a person who thinks that you should have a class, any kind of a class struggle, because I think that we can create structures that benefit everybody, and certainly many years ago that was the case, but there's been an ugly turn to scapegoating groups and instituting measures of austerity that actually factually do not hold water. So cutting Bolsa Familia will hurt Brazil, will hurt the most vulnerable. The country will, those kind of programs do not benefit a nation. It actually harms a nation. And it's really sad because those kind of programs are so innovative. We need to learn from programs like that you've created, because using evidence, using facts and data, they work, and government's responsibility to be able to, even the right of center saying people need to provide for themselves. Well, Bolsa Familia was a tool that enabled people to provide for themselves. And it was a good investment. So I hope that the government looks at this, uses the evidence, and changes their mind and recognizes that programs like Bolsa Familia serve the needs of the nation very, very well.
Great comments.
Okay.
Thank you so much, Keith.
No, we learned. When I looked at it, I've used Bolsa Familia in other talks I've given around the world, because I just thought, this is so smart and clever. And it was kind of nice for those who oppose it. On the right, they may think, well, we don't believe in those kind of social programs. But it was nice that they said, no, this is actually useful. It's good. It's a wise investment. It's a good rate of return. It's a clever use of the taxpayers' money, and it's not wasteful at all. So, yeah, I hope that the government will see the wisdom of not only maintaining it, but actually expanding it.
It is very nice to hear you saying that, because we had first the 8 goals of the millennium, but they were not reached. And in 2015, we started this 17 Sustainable Development Goals for 2030, which are a call for action. Hopefully, the disruption brought by COVID-19 will show us that we don't need a call for action, we need a cry for action. The time is now. And talking about time, I think that I will pass the word for our Vice President to wrap up this section.
Yeah, I just want to thank you very much again, Dr. Martin, and Professor Jennifer has some final words as well. Thank you.
Yes, I am really so happy that we had these great discussions and interaction with our community. As you saw, Keith, this is a really important topic for us, and the subject of this week, and it fits very well with the other lectures that we had during the week. By the way, this afternoon we are going to have, it will be in Portuguese, but you are very welcome to join us, Keith. We will have a round table it's called Tengo Dolor. It's about challenges in intercultural mediation for immigrants' health in outreach and assistance. And we are going to talk about with people with physicians and people from the social care that will tell us about another very hot topic, and that the academia that we are, especially us as a health institution of education, we really need, we have an important role. Anyway, let's keep in touch. I'm very glad that you opened several windows and doors for us. Next meeting, you can count on UFSPA, and I'm really sure, and I'm sure you're gonna receive in the next days lots of emails and contacts from our people asking for more information, and we're gonna share also your slides if you want, if you agree,
Of course.
because it will be on our YouTube anyway. But I think you mentioned lots of important institutions that can help us also to partnership. So thank you so much to ladies for the very good mediation, and especially to Keith for being with us. And
thank you the audience for the questions that participated.
Amazing. Yes, I'm very happy.
Yeah, no, it was just really, thank you so much, Jennifer, and working with Freddie, and also to start this off, and great to see you again. Anna and Mara, thank you so much for that. It was a lovely discussion. Thanks to everybody, to you listening in. Thank you to Isabella for making us run on the right track. Really appreciate that. And know at CUGH you have a friend here, and we'd love to work with you, learn from you, and collaborate with you. We have a common mission, and it would be our honor to do that. So we wish you all the best, but we will be in close contact.
Certainly. Yeah, keep safe.
Yeah, you too. Bye, everybody.
You can stay with us, Keith. You can stay a little bit with us.
Okay.
Just this section, yeah.
That's right.